Hi everyone, my name is Mohammadabadi and today I'm going to tell you about our project that involves using pulse-focused ultrasound to enhance the delivery of therapeutic agents for the treatment of head and neck cancer. High IFP and greater collagen in the tumor microenvironment have been shown to have negative effects on the extravasation and penetration of agents into tumors. We have shown in earlier studies in solid tumors that focused ultrasound can enhance the delivery of systemically administered agents like monoclonal antibodies. It can also be used for enhancing the delivery of locally administered agents. We hypothesize that focused ultrasound is non-destructively creating mechanical effects to lower IFP and allow for better penetration of administered agents. The system was designed around a commercial single-element 500 kHz transducer, and we use exposure parameters based on our previous studies. We designed and built a custom 3D stage, a cone for coupling with an inline degassing unit, and a custom laser guidance apparatus for targeting the treatments. A gold standard technique known as the Wick-in-needle method was used for measuring interstitial fluid pressure. We built this system based on previous studies. It was comprised of a pressure transducer, a strain gauge meter, Wick-in-needle, and a custom holder. A summary of IFP data shows the mean IFP at the center of the treated tumors was found to be 28% lower than in controls, which was statistically significant. A lower slope in the trend line for the pFUS treated tumors compared to controls, a coefficient of variation that was 42% lower for the pFUS treated group. This told us that not only was the IFP lower, but also the TME in the treated tumors was less heterogeneous. We then evaluated the same treatments in terms of nanoparticle delivery. Following a systemic tailwind injection of 40 nanometer fluorescently labeled nanoparticles, which were given after pFUS, tumors were imaged using an IVIS Xenogen in vivo imaging system at 24 hours post-treatment. We found an overall 49% increase in the epifluorescence signal in the pFUS-treated tumors compared to the controls, which was statistically significant. In a second nanoparticle experiment, we administered 200 nanometer fluorescently labeled nanoparticles after pFUS treatment. Tumors were sectioned into 3 regions of interest, and the mean intensity of fluorescent signals representing the nanoparticles within each ROI was determined. We found that in the outer region, there was an 18% decrease in the pFUS-treated tumors compared to controls. In the middle region, ROI2, there was no real change, and most importantly, in the innermost region, the percentage increased by 57% for the pFUS-treated tumors compared to the controls, which was also statistically significant. Finally, our colleague at the Catholic University, Chris Rupp, helped us in the mapping of bioreference parameters of tumors, which reflects the microstructure of the tumor fibrillar collagen network. In the interest of time, I don't get into details. Basically, we found that pFUS had significant effects on the extracellular matrix, but not the macroscopic structure. Based on all these results and previous studies, we have come up with a biophysical model to explain why it's happening, why we are getting an improved delivery and penetration. I will refer you to our recent publication in Physics in Medicine and Biology for a more detailed description of how this mechanism works. In conclusion, we demonstrated that pFUS pretreatments of solid tumors can non-invasively and non-destructively lower IFP, where these results were associated with improved penetration and overall delivery of nanoparticles in a solid tumor xenograft model. pFUS altered the microstructure of the fibrillar collagen network, but did not create any damage to the overall structure of the tumors. We have shown that we can enhance the delivery of cisplatin nanoparticle further with pFUS exposure, and as far as clinical translation, we are beginning to investigate the advantage of using focused ultrasound for enhancing the delivery of cisplatin in concurrent chemoradiotherapy and as an adjuvant for anti-PD-1 immunotherapy. I would like to thank everyone who contributed to this project at the University of Maryland School of Medicine and Catholic University. This project was funded by a grant from the University of Maryland Comprehensive Cancer Center and the School of Medicine. Thank you for your attention, and I would be glad to answer your questions.